everyone. So today I'm going to give you an introduction on the bisecting technique. So practically for bisecting PAs, you only need two things. You need the snap ray and you need one film. So now it's very important that when you mount the film on the snap ray, okay, first of all you have to look at the dot of the film. The dot has to be inside the teeth of the snap ray. Okay, it goes inside. Make sure it's not sticking out too much because you'll be wasting film on top and then you might miss the apices since it's a PA. So try to make it as flush as you can. Then what you have to do is just hold it tight. This little loose ring is actually the lock. Once you push it out, the film is completely locked, so it's not gonna go anywhere. It's not gonna fall out. Okay, so now I am gonna focus on the premolar upper PA. It is the same thing for molars. Okay, so today we'll focus on the premolar shaft. Any questions? Okay, perfect. So first of all, you have your dexter set up. Make sure it's strapped so it won't move. You're gonna open the mouth or ask your patient to open for you. Now, as you placing the film inside the mouth, there is two things you have to consider. Number one, don't hold the film straight up because when the patient bites down, this edge of the film might hurt the roof of the mouth. The patient might say, oh, that hurts. Okay, so what you're gonna do is tilt this a little bit and then go up. So as you're going up, the film kind of bends a little bit and it's a little nicer for the patient, so it won't hurt. Okay, so now, when you place a film, you have to make sure that the edge of the film, okay, since this is a premolar, these two are your premolars and that's your cuspid. The edge of the film is going to cover all the way to the mesial part of the cuspid. So I'm going to place it outside so you know what it means when it goes inside. So it's going to be like that. Okay? So when you go inside, the edge of the film goes to the mesial side of the cuspid, which is right there. Now another tip, push your film up against the roof of the mouth and hold it there. So when the patient bites down, there is less chance for the film to move. Okay, perfect. Once you have your film placed where you want to take an x-ray, okay, you gotta remember that no matter what you do, if you don't place the film in the correct area, you don't want to get the teeth that the doctor is asking you to get. Okay? So the placement is number one. Now, real quick, I'm going to show you on this PAD. If you come closer, okay, all machines have degrees marked. Okay, and all machines have a little line to mark the degrees. So right here, what you have to make sure is that you follow this, okay, especially if you need to take an x-rays. Now, normally the books start with the 20 degrees plus. That means that when I set this up, if we were closer, here we go, to 20, right there, the line is marking the 20 degrees. That means the PAD is going down. Why? Because we're on top, we're gonna come down like this. Now there is a reasoning for that, so let me explain that real quick. I'm gonna take this out. If you notice the film already falling back a little bit, so when that happens, when the x-ray is taken, the film brings the x-ray image or the tooth image with it. So what you have to do, you're compensating with that bend by creating the degree. So it's gonna accommodate this. If you hold a PAD straight like that, this is going to create an elongation, and that's an error you don't want. Okay? Any question? Okay, so I already placed back the film inside the patient's mouth. As a recap, we have 20 degrees set right here on the PAD or the X-ray machine, the X-ray unit. Now, step number one, okay? You don't want to hold the X-ray straight against the teeth like that because our teeth curve. And if you do this, you're gonna get overlapping. So you have to do small adjustment with what's called a horizontal angulation. That means you're gonna tilt the PAD slightly. Too much of these would cause overlapping. Not enough would cause overlapping as well. So we're gonna tilt a little bit. Now there's two things you have to consider right here. As reference, okay, make sure you align this part of the, you can come closer. This part of the PAD, which is the bottom part, align it with the snap ray. Okay? If it's too high, guess what? You're gonna get a concut. If it's too low, you're gonna concut the upper portion of the film. So make sure it's aligned at the bottom. Second, we already know that the edge of the film ends at the measure of the cuspid. So you're gonna align this side of the PID with the measure. If it's too hard, you can always use this little corner as a reference. So if you align it with that corner, you're pretty much there. Okay? Now you want to get closer to the patient. And again, always support the machine, and then with your body, you can just push the machine a little bit, ensuring that you don't hit the patient. Okay? What I recommend to my students normally is to leave a space about the finger's width. Okay, so if you're able to put your finger there, then you're good. You're close enough. All right? You don't want to do this. Okay? Come closer. Check the alignment here, check the alignment there. And guess what? All you're gonna do is just go there and take your x-rays. Any questions?